Hey, hi everyone. Continuing on the eye, I'm just going to point out the veins and arteries that are on the outside of the eye. Here we have the two superior ophthalmic veins and the two inferior ophthalmic veins. Now around where you have the optic disc, we have the short posterior ciliary arteries right here. Okay? Optic disc. This is also the lacrimal gland here. So now we're going to go inside the eye, but first, for the first compartment, the first thing you see is the cornea. Right behind the cornea, we have the aqueous humor. And what the aqueous humor is what it does is basically moisturize or lubricate the cornea and also the iris. Okay. Moving on. Help. I can't open it. So now for the inside of the eye, we don't actually have the lens, but the lens would be behind the iris. So this colored section that you see here is the iris. Now the iris has two different muscles. One of them is the sphincter papillae, and the other one is the sphincter pupillae and the dilator pupillae. The sphincter pupillae is going to be parasympathetic because it's going to constrict the eye, which is what's going to happen on a normal basis. But if you're in a fight or flight mode, which is for sympathetic, you're going to have your eyes dilated by the dilator pupillae. So as you can see, these are the dilator pupillae. They're kind of like radial shaped, kind of radiate like the sun rays. And the circular or sphincter go in circles. So you know the difference. Okay. So back to the model. There are three layers to the eye. The outer layer, which is the white layer that you see, is the sclera. Then right under that, which has a lot of blood vessels, is the choroid layer. And the innermost layer is the retina. And the retina is going to reflect most of the light that enters into your eye. Okay. Anything else? Okay. Here we go. Right here is right next to your optic disc is your fovea centralis. It's a place where you have the most acute vision. You have the most rods and cones. And right around it is the macula lutea, which is yellow. That's where it gets its name. And it surrounds the fovea centralis. And that's it.